Today we're going to walk through some of the key regions of our spinal cord and some of the functionality of them as we kind of work through. So imagine we've got our spinal cord, okay, and this is going to be a sectional region, a transverse section of my thoracic spine. It's going to look different in different regions based on what sort of signals they're sending. I want to start with the middle here. So we have this little butterfly. Forgive me for my lack of symmetry, okay? This middle region is our gray matter, right? So remember, gray matter is normally things like cell bodies and even dendrites that are gonna not have myelin on them, okay? So these processing areas where they receive information and decide if they need to send an action potential out. So we've got a few different gray matter regions. If I'm organizing it in the spine, in the very back, I have my posterior gray horn. This is going to receive sensory signals. Right here in this middle part, we have the lateral gray horn. And then at the front, truly the front, we have the anterior gray horn. And so both the anterior gray horn and the lateral gray horn are going to send out motor signals. So we're going to receive sensory signals in the posterior gray horn, and those can be communicated to the lateral and the anterior gray horn to send out motor signals based on that and based on what comes from the brain. It's a little bit more to it. We can further break down the gray matter regions based on the types of muscles and sensory signals they work with. So in the posterior gray horn at the very top, we have somatic, so things that I am aware of, right? So where is my body? What is it? What is some touch and feel? But then there are things that I'm not thinking about, right? Some visceral signals, right? I am not really aware of what exactly is happening in every blood vessel at every second of the day. My spinal cord is, though, primarily through some sensory signals that happen in the visceral portion of the posterior gray horn. When it comes to motor signals, we broke them down into two separate areas. So the lateral gray horn is going to be visceral, and the anterior gray horn is going to be somatic. Now, one of the things that's important to note is that the spinal cord is going to speak up to the brain and receive information down from the brain as well. It does so through three regions of the white matter. So all of this area that was surrounding that gray matter is white matter. So we have myelin here because we need to get that information up to the brain right away and get it down from the brain right away. It needs to move with some speed. So in the very back, we have the dorsal funiculus, and this is going to be primarily sending sensory signals upward. And there's specific tracks for specific types of sensory signals that are going to go up through the back. There are other signals that are going to also move up through the spinal cord in the lateral funiculus. So the lateral funiculus has separate tracks that communicate upward to the brain, so it's going to communicate some different signals upward. Again, depends on the track. It also is going to communicate some signals downward for motor as well. So it's going to send some sensory up and some motor down. These are different tracks for different purposes. The rest of our motor tracks are going to be communicated through the anterior funiculus. Again, for all three of these, right, these are going to be signals up to the brain and down from the brain. Going out to the body, going through the spinal cord, those are separate pathways and tracks that we'll talk about in another video. just as we will talk about these tracks, about how they go up to the brain and what they're communicating to the brain, and down from the brain and what they're communicating down from the brain in a separate video. But I hope this helps with orienting where you are on the spinal